afternoon. Thanks to everyone for joining our second webinar introducing New York Community Trust Program Officers. My name is Stotland, and I'm joined today by my colleague Irfan Hasan. Our colleague Rachel Pardo will be managing the chat box and helping us out. Irfan's been at the Trust for about 20 years, and I'm coming up on my 18-month anniversary. We're really excited to discuss our work. We'll each take turns discussing our particular grant making areas, go over this proposal review process, answer some frequently asked questions, and leave time for you to ask questions at the end. You're able to write in your questions using the Zoom text box. Rachel will select questions to read aloud. We will stop a few times during the presentation to take questions, and we've also reserved some time at the end. We thank you for taking the time, particularly given current circumstances, to join us. We want to thank you and your organizations for doing all that you do to keep New Yorkers safe, healthy, housed, fed, and supported. After the presentation, we'll send you a link to a brief 2-question survey via email. We really value your feedback, so please complete the survey. If you'd like to provide more feedback, you can reach out to me directly. My contact information will be provided at the end of our presentation, and it's also on the Trust's website, as are the emails of all of the program officers. Before I hand it over to Irfan, just a few logistics. Everyone is muted and your videos are disabled. Please use the chat function to send us your questions. Finally, this webinar will last for an hour and it is being recorded. Now, I'll turn it over to Irfan to talk about his program areas as well as the Trust's efforts in response to COVID-19.
Great, thank you. The Trust's health and behavioral health program goals are to promote an equitable, patient-focused, and cost-effective health and behavioral healthcare delivery system. Our focus is on 4 broad areas. First, we endeavor to advocate for successful healthcare reform implementation by ensuring a strong and viable safety net that can provide comprehensive and coordinated care for low-income New Yorkers, as well as those who remain uninsured or underinsured. Second, we seek to build the capacity of health and behavioral healthcare and human service sector providers through effective skills training for professional and paraprofessional workforces, and to strengthen the financial and informational technology systems to aid these providers to transition to a value-based payment system. Third, we push for reductions in health disparities between low and higher income neighborhoods through grants to improve indoor and outdoor air quality, increase usable outdoor space, and promote access to affordable and healthy food, as well as physical activity. Finally, we foster the independence of people with mental illness and substance use disorders by expanding clinical care and practical services, especially participant-led or informed services. Before I hand it over to Eve, any questions on the COVID-19 fund or the health and behavioral healthcare guidelines? All right, then I guess, next slide, please.
So this is Eve again. I have 2 grant-making areas at the Trust: human justice and education. I'll start with human justice. The goal of our human justice grant-making is to promote a more effective and fair civil and criminal justice system. We support efforts to provide advocacy, information, and representation in emerging or urgent areas of civil law where other funding sources are limited, including by helping advocates and legal service nonprofits act quickly when laws and policies change, and supporting advocacy and litigation to protect New Yorkers' civil rights and make law and public policy more responsive to the need of the city's most vulnerable residents. We also support efforts to identify ways to help low-income New Yorkers resolve legal problems by testing the effectiveness of different service delivery methods and connecting legal help with other desired outcomes through program evaluation and collaboration with other social services providers. And finally, by building the capacity of legal service nonprofits to track and communicate their results. An exciting note about the Trust's grant making in the human justice arena is that we support just about every approach to systems reform, including litigation, direct and grassroots lobbying, and community organizing. Next slide, please. My second funding area is education. I'm going to go ahead and talk about education, and I know, there we go, here's the education slide. So, in contrast to our grant making for the human justice arena, our education grant making focuses on a single system, New York City public schools. The goal of our education grant making is to ensure that New York City's public schools prepare students for success in college and the workforce, and for participating in public life as creative and responsible citizens. To this end, we fund efforts to build and mobilize public will for greater equity and quality in the school system through research, advocacy, and grassroots organizing. We support efforts to increase accountability and transparency of schools and the system to parents and students in low-income communities, communities of color, and immigrant communities. Finally, we support efforts to expand innovative strategies for improving middle and high schools in the areas of principal instructional leadership, positive school cultures, and student leadership and academic supports. In general, we tend to focus on advocacy and direct services projects that support students with the highest level of unmet needs, including, but not limited to, immigrant students, English language learners, students with disabilities, students of color, and students in temporary housing. A quick word about what we do not fund in our education grant making. We do not make grants to private schools, charter schools, or to programs that serve just one public school. Given our focus on school systems and school time, we don't fund standalone college access or persistence programs. Now we'll stop for a moment and see if anybody has questions on education, human justice, or Irfan's grant-making areas, the COVID-19 fund, and health and behavioral health. Rachel, do you have any questions for us?
No questions came through. Just a reminder that you can, here's one. Are human justice opportunities on the policy level? I think asking yes. Whether that you can do some policy analysis and policy change work, whether you support that.
That's a great question. I'm just going to repeat it as I heard it. I hope I get it right. Can human justice projects, or will we fund human justice projects that are working to change policy or implement policy? And the answer is yes. We fund human justice strategies that are direct services. We fund some that are focused on research, and we certainly fund some that are on legislation or policy.
Okay, so here's another question that came through. Is there any work being done on the elementary school level?
Certainly. We can talk about this a bit more at the end. So elementary meaning, we'll say before middle school. We've been doing a lot of literacy work, early literacy programming and research through our Astor Fund. And we'll be incorporating that work into our general education grant making work in the coming years.
There was another question that came in, whether the trust funds direct legal assistance.
So the trust does fund general legal assistance. What we try to do generally across our portfolios, certainly in human justice, is to not double up on city, state, or federal funding. So you'll see that, let's take an area where, although resources are not adequate, there is a comprehensive funding stream that's in the area of criminal defense. So because criminal defense is does have, it's constitutionally required to, the city and state are constitutionally required to provide free attorneys for criminal defense matters. That is not an area that we will directly fund. However, we will fund efforts in support of that area. For example, if a public defender's office wanted to try a new approach, or certainly back into the policy arena. So that's just one example of how we will fund direct legal services, but we try to do so in a way that adds value rather than duplicates programs that are already funded by the government.
So here's a question for Irfan's program area, and mine as well, actually. In regards to capacity building grants, does the trust support construction or renovation of facilities to provide new and expanded services that fall within the program area, specifically for health or mental health facilities?
So the trust does not support construction of any facility, whether it is a healthcare facility or a human service organization. What we do fund is some of the planning within the healthcare facility context. Those of you in the sector know the jargon around certificate of need planning, et cetera, and the consultants that might be required in getting that together. We do support those sort of efforts, but we don't support the actual construction.
The other question that came in, a couple related to this, was whether our COVID-19 funding will move beyond urgent needs and whether our regular grant making will cover some of the needs for longer term issues. So, for example, the impact on education or the impact on health and behavioral health.
So for the first part of the question around the COVID-19 fund, that fund was really focused on immediate needs and will not continue in its current form. We're figuring out whether there is a possibility with other funders to look at doing something as a stage 2, but at this stage there is nothing that is quite ready to go. With respect to how do we look at recognizing the realities of COVID-19 for ongoing programming, I think we all realize that it is affecting every single nonprofit, every single New Yorker. And while we are not pivoting completely to make everything a COVID-19 related grant, we do recognize that particularly on some of the systems change efforts that I'll get into shortly, we do need to be cognizant on what COVID-19 has resulted in and what different systems may need to be put into place.
Okay, there are a couple other questions that were that came in that we're going to cover later on. So if we actually don't get the answers to your questions, I'll make sure that we cover those. But we'll go over some of our kind of geographic eligibility as we move on. So I think we can go on for now.
Great. Thank you, Rachel. So having talked about my program areas and Irfan's, and please remember that we have many others, and there will be future Meet the Program Officer events. We're going to turn to our proposal review process, how we accept and make determinations and communicate those determinations to the nonprofit world. Thanks for the next slide. So let's talk about our proposal review process. The first thing to note is that we accept applications at any time. We have an open application process. This means that you don't need to let anybody know or to get our approval or permission before you submit a proposal. It also means that usually you do not need to submit a letter of intent or wait and respond to a request for proposals. We do issue from time to time and in certain program areas letters of intent or use requests for proposal processes, but that's not our main way. Our main way is an open and rolling process. The dates on our website are not deadlines. Rather, they provide a time frame for when applicants can expect to hear back from us. Again, no timelines because it's a rolling process. Our website provides very concrete instructions for applying, so please read it carefully. Since we've moved to remote operations, the entire process is electronic and online, no paper copies anymore. Every week, we receive and meet. We meet to review and assign all incoming proposals. The proposals are assigned to one or sometimes two program officers at that meeting, unless it's obvious that it doesn't meet our threshold guidelines. These are stated on our website, but I'll go over them briefly here. We do not fund grants to individuals, general operating support, capital and building campaigns, endowments, equipment, deficit financing, or religious purposes. The organization will receive an automated email from us once the proposal is assigned, or if it's declined at this point. All emails are sent to the organization's paid staff head, as you have identified that person on the proposal cover sheet. So give some thought to which email you use, because that email address, one person at your agency will get these notifications. We've also heard that sometimes our emails to you get lost in spam filters. So we advise you to add this email address to your inbox. No reply at newyorkcommunitytrust.org. That's NOREPLY at nycommunitytrust.org. One other thing to note is that we as a team decide who the proposal will be assigned to. That's not something you as an applicant need to determine in advance. You will be notified that the proposal is assigned, but the email will not tell you which program officer is working on the proposal. Next slide, please. So once the proposal is assigned, the program officers complete a full review of it. Briefly, the program officers assess the quality of the proposed project. They ascertain whether it's a systemic effort and a sound approach that meets a need and is not a duplicate of other efforts. They look to see whether the activities described will actually address the stated issue, and if these make sense given the context of the field. They look at the organization's finances and governance and whether it has the capability to carry out the project. And they assess the project's relevance and alignment with our grant-making guidelines. For example, those that Irfan and I set out earlier in this meeting for our own grant-making areas. At this point in the process, the program officer will decide if the project merits further investigation. If so, they'll schedule a meeting and site visits with the nonprofit. We generally only conduct site visits with organizations we are seriously considering for funding. If the proposal does not merit further investigation, we will decline it. All of our declines are reviewed internally before applicants are notified. All decline notifications will be sent via email, again, to the paid staff head identified in the proposal cover sheet via the automated address. If warranted, the program officer will develop a grant recommendation, which is then reviewed internally and presented to our board. Our board meets 5 times a year: February, April, June, October, and December. And all grantees are notified of board approvals on the day of the board meeting. Now Irfan will answer a few common questions about our process.
Great. Next slide, please. Oops, waiting for the next slide. Great, thank you. Before I get into the slide, please remember to continue to send your questions via the chat function to Rachel. A common question we get is, why don't program staff meet with potential grantees before they submit proposals? And the answer is pretty simple. Because of the volume of proposals we receive, we are just not able to meet or speak by phone with every organization to help them decide on a project before submitting a proposal. If we did so, I would guess most of our time would be focused on that, and we wouldn't be making the grants we need to make. Applicants should read our guidelines to ensure that the project they're proposing aligns with our grant-making goals, and then just go ahead and submit a proposal. You do not need to determine which program officer should receive the proposal. As Eve mentioned, that's done internally. If a project is recommended for a grant, those of you who have worked with us know that we follow up with questions and clarifications, probably more than you ever wanted. Next slide, please. A second question we often get is, what do we look for when reviewing proposals? Three aspects make a proposal quite compelling. First, will the project advance systemic change? So, is there potential for government funding and/or policy change in the future, and/or lessons for other service providers? Second, does it affect the sector broadly? Examples include a pilot of an innovative and promising program that's being expanded, expansion or replication of efforts sector-wide, or gathering of data to build proof of a program's value. And third, does the program incorporate proven practices? For example, will it test promising approaches in a new neighborhood, a different population, etc.? We do support advocacy, and we actually also support grassroots and direct lobbying. That's not usual with most foundations, but we do support it. But such advocacy must be for a specific effort or a very targeted project. We generally do not support projects that serve a small number of people or a single site, one-off exhibits or events, conferences, or efforts that build the internal capacity of a single agency without the potential for broader impact for the field. We recommend that you review our full grant-making guidelines for more information on exactly what we support and what we don't support. The next slide, please. Finally, a few points about what makes a proposal competitive. First, clarity, brevity, and focus help us understand the core issue. Second, concrete details on how and why the organization requesting support is best suited to carry out the activities helps build a case for funding. This includes not only its deep knowledge of the field or the community that it's working in, but also its financial and governance stability. Finally, you should know that the Trust uses the Better Business Bureau as a starting point to review governance standards. It is paramount that the board is independent and unpaid with at least 5 board members. Before I pass it on to Eve to discuss budgets, are there any clarifications that I can provide on what I just covered?
Yes, this is Rachel. There are a couple questions that came in. One question was whether we support programs in the area surrounding New York City. So whether that could be New Jersey or Long Island.
Sure.
Are those programs eligible for funding?
New Jersey, unfortunately not. Long Island, through us, no as well, although we do have an affiliate, the Long Island Community Foundation, and they do serve the 2 counties in Long Island. On occasion, when there is a statewide type of issue, where particularly on the advocacy front, we will partner with our colleagues in Long Island at the Long Island Community Foundation and in Westchester at the Westchester Community Foundation and look at something regionally sort of for the downstate 8 counties.
Another question is whether we are open to having conversations after an organization receives a decline from us.
We have on occasion had those conversations, but being very honest, they don't really go anywhere and aren't particularly productive either for us or for the grantee. Most of the times, unless something is outside of our guidelines, there's just not enough money for us to support everything that might need to be supported, including some good ideas. So we tend to try to minimize those types of conversations.
This is somewhat related. There are a lot of questions coming in that are asking about a specific idea or program. So what advice would you give to an organization that has an idea and would like to speak with us, but may not have the opportunity to do so?
So our proposals are pretty simple. We ask you to submit no more than 10 pages. I would say 5 to 10 pages describing what the issue is, why you are the organization to carry it out and address it, and what the activities will be in doing so. Submit it. it will get looked at. Everything gets looked at and gets looked at very, very thoroughly. So I think that's probably the best way to do so.
Question came in is, how many years will we fund the same program, or do we make multi-year grants?
We typically make single-year grants, sometimes 18-month grants. We will make renewals for projects as they progress from one stage to the next stage, typically for about up to 3 years. After that, it starts to slide into some of the areas of more general operating for an organization versus a discrete project.
Okay, thank you. There was a question about whether organizations can submit one proposal, more than one proposal at a time.
Technically, you can submit a proposal every day of the year. There is no limit. Would every proposal be looked at? Probably not. We have found it usually doesn't work well when organizations submit multiple proposals, because we may pick a proposal that you submitted that is not your highest priority. And I think we all know that when something isn't the highest priority for a group, then the results are usually less than satisfactory for what we are looking for. So we recommend you just submit one proposal at a time.
And then another question is whether we have time limits after a declined proposal in which an organization can submit a proposal again.
No, people can submit. You can submit whenever. There's no requirement to wait for 6 months or a year or something like that.
Right.
Because our submission process, as Eve mentioned, is a rolling submission process. You know, if you submit something in March, you're informed in June that you're unable to support that project, you're welcome to submit, you know, in the fall again. Probably wouldn't make a lot of sense to submit for that same project, but for another project, absolutely.
Right. And the last question is a little bit more general, is whether we, because I see a lot of questions coming out about whether we have partnerships with specific foundations. So maybe you could say something about whether we partner with our philanthropic colleagues in New York City and what that looks like.
Sure, and I will actually defer to Eve to start that question in talking a little bit about the Fund for New Citizens as one example of a collaboration, and then I'm happy to come back in and share other less structured collaborations that we have.
Sure. One of the, so the Trust houses and participates in many funder collaboratives. This is a group of funders that come together to work on sometimes an issue, sometimes on a population. And it's my privilege to facilitate the Fund for New Citizens, which is a collaborative of 11 foundations, including the Trust, that make grants to immigrant-led and immigrant-serving nonprofits here in New York City. So that's one of the main ways that the Trust collaborates with other funders in New York City.
Right, and then I would say sector by sector, we work closely with our colleagues in other foundations. Often we align our funding for a particular project. Sometimes we are the initial funder and another funder will come in a little bit later. Sometimes we're able to kind of start a project together. So we do work with other foundations in our grant making, but we realize our resources are limited, and it is rare that for the sort of systemic change that we're trying to put forward, we'd be able to fund that adequately.
Okay, those are all the questions for now.
Great. So next slide, please. And I hope everybody, you know, take a breath. Maybe do some jumping jacks or stand up for a minute, because we're going to talk about budgets. I'm a budget nerd. I like budgets. So I'll try and make this as easy as possible. So budgets are important because they tell us a story. They tell us a story about how much you think that a project or an initiative will cost, and how you're going to spend our money and what other money is available to you to, for that endeavor. All program officers complete a thorough review of the organizational and program budgets, as well as additional financial materials such as audits, Form 990s, as part of our proposal assessment process. I'm going to go through a few pointers, especially about what we call the project budget. So project budgets should reflect all of the anticipated costs of carrying out the proposed project. And this should include overhead, otherwise known as administration or administrative expenses. Happily, we do not have a cap on administrative expenses for the vast majority of applicants. However, we will look at the administrative expenses and see if they seem reasonable. If they don't, it's not a deal breaker. If we're interested in funding that project, we're going to ask you, why are your administrative expenses, in our opinion, high or low? We do have, as a sort of an exception, a 5% cap on administrative expenses for grants to universities and affiliated nonprofit fiscal sponsors, such as research foundations. Again, this is an important cap to know about if you're at such an institution, but for most of our applicants, there is no cap on administration. You should ask for the amount that it actually costs to administer your programs. Budgets should include funding received or projected to be received from other sources. We will often ask if there are any budget gaps or surpluses. Again, not a deal breaker. We just want to know what's going on. If a cost is not discussed in the narrative, it shouldn't be included in the budget. And the budget should reflect, again, the full amount of the project's cost. Don't just show us how you will spend our money. Occasionally, especially for small projects, the trust might be the only funder, but it's much more common that an organization is pooling several sources of funding to do a project. And we want to see the whole cost and the whole financial picture. Lastly, budgets should not include portions of every single or almost every single staff member, because that looks a lot like general operating support. Next slide, please. So this is a sample budget. This one is for a single organization that's applying to do some work on its own. And it's important to note that a budget for a collaborative or a coalition is going to look quite different. This is a nice format. This is not a mandated format. We don't have one template. Use your own template, whatever you use. But I think this one is easy to read. So going through this a bit, you'll see that the expenses are separated into 3 categories: personnel, program, also known as direct costs, use whichever title you want, and administrative costs, also known as administration. Note that the personnel line includes fringe and benefits for the identified staff. The program costs include everything needed to successfully complete the program. Some examples include program equipment, consultants, food, honoraria for attendees, and Metro cards and childcare for program participants. Note that this applicant has, as we request, budgeted and included a line for $22,000 in administrative costs. The income lists all of the projected and secured income from private foundations and government. I think it looks like this applicant only had private foundations and government income, but income could also include earned income, fees, reimbursements, and donations, for example. Please, the expenses should equal the income. The budget should balance. And please round all costs to the nearest thousands. We appreciate that you tell us the actual projected amounts, but if it's 19 cents, we're not going to give you 19 cents. You don't want 19 cents. So the nearest thousand is the easiest way for us to do this work. Next slide, please. What's the difference between an organizational budget, a project budget, and a grant budget? This is a common question. An organizational budget is usually approved by a nonprofit's board, and it lists all the expenses and income projections for the entire organization over the course of a year. We want an organizational budget, and it needs to be in your application. We also want a project budget. As opposed to the organizational budget, the project budget was the one that we showed an example of in the slide before. And it is a snapshot for the single project or initiative that you're seeking funding for. If a project is expected to take more than 1 year, the project budget should reflect that. We also want a project budget, again, an organizational budget and a project budget. Grant budgets, something that would show just how you spend the anticipated amount from the trust, are not required. Although we will, if you get a grant from us, ask you at the end of that grant to tell us how you spent our funds. So again, we need an organizational budget and a project budget. And I'll pause here to see if people have any questions about budgets. Rachel?
There are no questions about budgets right now. We have a few questions more generally, so I'll wait till the end to ask those. Oh, actually, wait 1 second. Someone asked whether we will accept 6-month organizational budgets because many nonprofits are having a hard time predicting budgets beyond a 6-month period.
So I do not know the answer to that. Sean is on the call. Should we hold that question for the end?
Sean, you're unmuted if you'd like to go
Unmuted.
ahead and answer.
So I think what we're trying to get, this is Sean Moorhead. Hi, everybody. What we're trying to get from an organizational budget is a sense of where your money is coming from and what you're spending it on. And I do think, given the current environment, a 6-month budget with an explanation of why you're doing that is a perfectly reasonable thing to present to us, given the uncertainties of today. So it's really just about giving us good, accurate information. And if that's the most accurate, reliable thing, then that's what you should submit.
Okay, there are no other questions right now, but I think you can go ahead.
Next slide, please. So I think there was a question earlier about renewals and multi-year grants. So let's talk a little bit more about that. First, I want to iterate that we make project-focused grants. We look for a specific opportunity and we do not fund ongoing projects. However, absolutely some projects take longer than a year, and we do make multi-year grants on occasion. And I want to explain that the main reason we don't make every grant a multi-year grant, or most grants multi-year grant, is financial, because we want to absolutely ensure that whatever we pledge to you, we can make good on. When a program officer makes a grant, we have to allocate funds from our current annual budget. So if I make a 2-year grant in this year, 2020, I'm going to spend a very substantial part of my current budget because I'm going to cover the entire cost, 2-year cost, or you could say 3-year cost in this current year. And so for that reason, it is something we do at the discretion of the program officer, but we're not always able to do it even when it's indicated. We also make renewals. To do so, we look at the progress and the success of the grant and the context, such as changes in city government, to see whether a renewal makes sense. Again, we recognize that system change takes time. Piloting new programs take time. Expanding programs, even running a program, takes time. But we are a project-based funder, and so as Irfan said earlier, after a certain number of years, it's hard for us to really understand the project as a project rather than as general operating support. So I'm going to turn it over to Irfan now to discuss donor-advised funds.
Great, thank you, Eve. And next slide. Great, thanks, Rachel. So it's been about 85 years since the Trust pioneered the Donor Advised Fund, or DAF as we call it often, a mechanism to support nonprofits. A few key points about donor advised funds. First, our donor advisors suggest grants from their funds independently and throughout the year. Second, donor advised funds do not accept proposals. And third, our donor advisors are encouraged to call us about grantees we feature in our publications. I'll end our discussion with a very commonly asked question that Eve has touched upon. And I think I just want to reiterate it because in this time and era where there are significant financial challenges, there is a lot of push on trying to pivot everything to general operating, and wanted to share why the Trust still does not just provide general operating funds from its regular competitive grant making. First, first, the reason why we don't provide just general operating funds from our competitive grants is that a lot of our donor advised grants are almost always general operating support. Second, our competitive grants are for projects that allow us to advance the goals that our board has set for each grant-making program, as described in our priorities. And because our competitive grants are supported through hundreds of funds that have been left to us, some with very, very specific purposes, it's actually just legally impossible for us to just provide general operating support. These purposes can be really, really specific, from helping injured, needy, young, classical ballet dancers. So you can't be injured, needy, young, modern ballet, really, really specific, to a couple more which are more general in terms of improving health and welfare in New York City. With that, we'll open it up to questions that you should submit through the chat function. I think there are a few questions already in there that Rachel has lined up for us, and happy to start to answer those. I think we have about 15 minutes to kind of get through some more questions.
Sure. So this question came from Irfan, but Eve, you can answer as well. Irfan, you mentioned that the Trust does not fund projects that take place on only one site. Is this true for all of our programs, or is it just the case for the health and behavioral health program?
I would say it is pretty much universal for all our programs. And we try to have when you say projects, again, if it's a direct service effort, then at a single site, it particularly wouldn't make sense.
I think it's a little different in the human justice portfolio and in the education advocacy portfolio. With advocacy, it can be sometimes a little hard to talk about a single site, especially if people are doing organizing, but it might be a single organizing entity that is working in a particular part of the city, for example. We certainly fund projects that are not citywide. They might focus on a particular borough or on a particular constellation of neighborhoods where a problem is particularly grave or a great solution is happening. And then in the education arena, it's a little bit more true. Although a single New York City public school may be the place of learning pre-COVID for hundreds and hundreds of students, we look at, because of the scope of the system, we really look at programs that are operating on more than one school site.
Okay, thank you, Eve. There was a question that came through about healthcare disparities, which we know is a priority for low-income New Yorkers. The question is whether there's a conversation among other foundations coming together to collaborate and address this issue, especially in light of COVID.
Sure. So there is no formal fund or organization that has been developed by funders in healthcare to address this in a more formalized manner. What I will say, certainly since COVID, there is a group of health funders who have been meeting on, I think it's once a week, usually on a Monday, just to share where things are with often COVID, but beyond COVID as well, because we do realize that the impacts of COVID are not equal. And thinking about how do we, through our individual grant making, as well as some of the new support funds that were established as part of the COVID response, address some of the disparities, certainly those caused by COVID, but perhaps more importantly, those that have been long lasting and entrenched into communities. I'll say our general grant making program, our competitive grant making program, our health and behavioral health program at least, has very much had reducing disparities as a key focus. And a lot of our work, particularly with some of the larger institutions, historically has been with trying to shift the systems in those communities of high need.
Okay, thank you. There was a question about the COVID-19 loan program, which is different than the grant making program. The question is whether the funds are still available. And this person had a specific question about their eligibility. So perhaps you can answer, if they have questions about eligibility or like to speak with someone, if there's a contact person that we can put them in touch with.
Sure, and Sean, if you want to jump in after I kind of give at least my thoughts, please do so. I understand the loan program is still open. There are some very, very specific requirements to be able to apply for the loan in terms of financial performance over the past 2 or 3 years and potential sources of revenue. The eligibility is pretty clearly laid out. It is on the Nonprofit Finance Fund website. You can get to it through the New York Community Trust website as well. Sean, is there anything else you'd like to add on the loan program?
No, I think as Irfan said, the Nonprofit Finance Fund has been administering that and has a group that are looking at agencies, looking at their finances and making those loan decisions. We, as an institution, don't have any influence over those.
Okay, thank you. Perhaps you could answer a question about the decision-making timeline for the COVID-19 Response Fund, just about organizations that submitted a proposal before the deadline on April 22nd. When can they expect to hear back?
I'm going to defer that to Sean, just because I think she has the bigger picture. I just know a component of it.
So we have issued more, I think around 500 grants already. And some groups have also gotten decisions or emails letting them know that we are not going to be able to make a grant. We are in the process of trying to get the final rounds of decisions out, and I anticipate that that will take the rest of this week and next week as well, and we hope to have everything out, both yeses and nos, in the next 2.5 to 3 weeks at the outside.
Okay, thank you. There are some questions that are coming through that are not related to the health and behavioral health and human justice education programs. So perhaps, Sean, you can answer some of these. The question was about whether we are continuing to support youth development programs. And perhaps you can say a little bit about our timeline, because this individual was asking specifically about support for programs this summer.
Sure. So we are continuing to make grants in all of our program areas. We have not stopped our usual grant making processes. We have adapted them to the new reality that we're all living in, but we will continue to make youth development grants. For summer, we have already made one substantial investment to Expand Ed, which will then help re-grant to agencies providing summer programming, particularly something that's trying to be a substitute for summer youth employment. I don't anticipate that we're going to be able to get a lot more money out in the field for this summer beyond that, just given timing constraints. But we will continue throughout the year to make youth development grants.
Okay, thank you. There were some clarifying questions about general operating support. So a person asked whether it's considered general operating if the budget included support for a staff person who's working on a new project.
No, that's not general operating support. You know, that is project-specific activities. We are more than happy to recommend grants to our board that include funding for staff time.
And then there were some questions about updates regarding specific program areas and specific funds. So perhaps you can say something about our website and when we put up RFPs and LOIs.
Sure. So most of our grant making is done through the open application competitive grant making process. We have pivoted to also do everything remotely. So all applications are submitted in online. There is no paper right now. at least not until we are back in the offices. If there are particular RFPs that are up and running, you will see them on the website. I believe currently we have an RFP for a invitation-only program for that we are working with New York Life on. There is an RFP for, I believe, a youth program, the Heisman program, I believe, is up there, and then one other RFP. Most of our work is done through our competitive grants, but they just come up onto the website whenever they get released. So checking the website is a good thing.
We do also typically announce a new open RFP through Twitter, on Facebook, and other social media channels. So following the trust is a great way to keep informed about those coming out. And then we have a regular schedule for our National Environment Program. So if you look at our website, it'll tell you when the letter of interest process opens for that, and that happens twice a year.
Okay, last chance to ask questions. Because at this point, I think we've answered everything that came through. If I missed you, you can pop in your question again. Otherwise, I think you may have covered everything. I don't see any more questions coming in.
Well, thank you all so much for taking the time and hearing us out. We hope it was useful, and we hope you'll give us feedback through the survey so that we can continue to make these even more useful for folks who are interested.
Thank you.
Thank you so much,
Thank you.
everybody.